Today we're going to talk about hormonal imbalances and their contribution to fertility. My name is Ujvala Rao. I am a fertility specialist working with IVFAustralia. The first thing to talk about is what a hormone is. A hormone is a substance that is released in the body that is released by glands that belong to the endocrine system. And these substances have effects not only locally where they are secreted, but also in distal parts of the body. The most common endocrine glands that we talk about in fertility, starting right from the brain, would be the hypothalamus and the pituitary, going down to the thyroid, going down to the pancreas, and then down into the ovaries and testes. But there are many, many others. When a woman or a man or a couple are trying to have a family, and if it's difficult, it is very common to wonder, is there something going on with my hormones? Is there something that I could do to balance these? The first thing to say is we need to think about what symptoms there are of a hormonal imbalance. The symptoms of a hormonal imbalance include irregular cycles. For example, polycystic ovary syndrome is a very common cause of irregular cycles, and there is some hormonal imbalance here. The other symptoms can be people who have extra acne, extra hair growth, people who have big swings in their sugar levels, blood pressure, people who have a history of thyroid problems. All of these things can be features of a hormonal imbalance. For a woman, a hormonal imbalance is most relevant if it's causing you to have irregular cycles. It is normal for levels of estrogen, progesterone, and other hormones to fluctuate over the course of your cycle. That's what's meant to happen. But when these ebbs and flows don't happen in a way that corresponds with ovulation, then it's likely to give you irregular cycles. And so a woman who has irregular cycles does need to see her doctor sooner rather than later to try and work out why this might be. The situation of irregular periods, especially in conjunction with a polycystic ovary syndrome, is very readily treatable. And the prospects for having a family in this condition are very, very positive. The other situations where hormonal balances may be at play are if you've got other medical conditions or if you've had a history of treatment, medical treatment, particularly for conditions like cancer, diabetes, thyroid problems. If any of these things happen, then you are at increased risk of having hormonal fluctuations that affect your fertility. If any of these things occur, it is worthwhile seeing your GP and getting a referral to a fertility specialist sooner rather than later, because most of these problems can be addressed to help you have your family. The advice I'm going to give you is the advice that you've probably heard many times. This advice pertains to being generally well and healthy in all aspects of your life, including your fertility. The first thing is to maintain a healthy body mass index. This varies from woman to man, but for most people will fall somewhere between 18 and 25. The second thing will be to eat well and eat a diet that is rich in fruits, vegetables, protein, and dietary fiber. The next things that you can do are things that are also very good for your general health. Exercise, aiming for at least half an hour of exercise at least 5 days a week. Sleep is very, very important for hormones. It regulates almost every kind of hormone secretion in your body. So working on not only sleep quantity, but also sleep quality is paramount. The things that I have found helpful personally and with my patients are the practice of mindfulness and the practice of deep breathing. This will help manage stress levels as well, which is also intrinsically tied with hormones. Stress is a normal part of life. People get pregnant in the most stressful of situations all the time. But what I would say to you is all of us could manage our stress a little bit better, eating well, exercising, sleeping well, maintaining a healthy body mass index will help manage stress as well. There has been many studies looking at the safety of hormonal contraception on long-term health and also on fertility. And I can say to you safely that taking the pill or other hormonal birth control is not going to cause you long-term problems in having your family. What hormonal contraceptives do most of the time is that they temporarily stop ovulation, or they change the environment within the uterus and the cervix such that an embryo cannot form or implant. Both of these situations occur because hormonal birth control temporarily stops the normal ebbs and flows in the hormones that govern ovulation. The effect of those hormones wears off within about 6 weeks of stopping the medication. When it comes to longer term or long-acting reversible contraceptives like the Mirena or like the Depo-Provera or like the Implanon, it can take around 6 months for the effect of that to fully go away. But rest assured it will. And this will not cause you long-term problems with your hormones that cannot be fixed just by waiting it out. It's been a pleasure talking to you today. Thank you very much for watching. If you'd like to stay updated, please subscribe to our channel. Thank you and hope to see you again.